Uh, uh, Tell us, our audiences, about your journey. I mean, since when you
Yeah.
started preparation, when did you pass AKP,
Yes,
and then
ma'am.
how you started preparation, which book you read,
Yes,
from
ma'am.
website, or who gave you guideline? Just few sentences for our audiences.
Yes, ma'am. So before I start, ma'am, from the beginning of my journey, it's been you, ma'am. Like I've been following you. Just now I'm attending your classes, but all my theory I've been just following you, ma'am, silently. So thank you so much, ma'am. So when I decided to do MRCPCH, like I was not very sure like where to start because it's a totally a different country's exam. Just some people said me you have to just read Nelson. And yeah, we started reading Nelson, but that did not help, ma'am. And then one day randomly in Telegram, I was just putting MRCPCH books, and that is when I found your group.
In Telegram, my Telegram channel.
Yes, ma'am. Telegram channel. Yes, ma'am.
Okay.
I'm not sure like when I wrote my FOP and task, ma'am. But that is the point. I don't remember the date, ma'am, properly.
Mm-hmm.
2021, I guess, ma'am. No,
Mm-hmm.
2020, ma'am. I gave my FOP and task, ma'am.
Okay.
And then that is when I found your group and your advices. I read through advices and the books you recommended over there. Um, uh, like this SOP and all that guidelines book which you shared over there. And your most the thing which helped was the recalls, ma'am, for FOP and TAS.
Mm-hmm. Mm-hmm.
So for part one, I gave both FOP and TAS together. I cleared TAS, but I did not clear FOP in the first attempt. Then after that, only I found your group, and then I went through all recalls and the books you suggested, and all your thing. Then I cleared FOP, and then I started preparing for AKP. So AKP also, I just followed your advice, which you used to put in the group with all your books and recalls, ma'am, and guidelines. And
Mm-hmm.
then I cleared AKP in I think 2021,
Mm-hmm.
and then I gave my DCH in 2021 November, ma'am.
Mm-hmm.
And then yeah, and then I thought I'll start preparing for MRCPCH clinical.
You passed
That is
DCH, you passed DCH before MRCPCH, isn't it?
clinical. Yes, ma'am. Yes, ma'am.
In the UK
Yeah.
center, right?
No, ma'am. That I gave it in India online, ma'am. That November
Yeah.
exam was done
Yeah,
online.
yeah, UK exam. Yeah, yeah.
Yeah, yeah. And then I got married because my husband was working here. He finished lab and got a work over here, ma'am.
Mm,
Moved in here. And after that, only they said by MRCPCH, if you finish, you can register in GMC to get a job.
yeah.
Then this October, I gave my clinical in the first attempt, but I could not clear that time, ma'am, because I did not know the format.
Okay. Mm,
And then, yeah, I joined your class. I got to know the format, ma'am, like how it is.
mm. So you attempted one time before, right? Joining our batch.
Yeah. Yes, ma'am. Yes, ma'am.
That
Yeah.
was online exam. That was online UK
N-
exam, right?
No, ma'am, that was face to face with no patients.
No patient. That after
Yeah.
COVID, it just started, isn't
It
it?
just started. Yes, ma'am. Yes, ma'am.
Mm.
Yes.
So,
Yes.
okay, so you had one idea actually
Yeah. Yes,
when
ma'am.
you gave exam, you had one. And
Yes, ma'am. I just knew that it will be like this. But I knew that we have to know the format for passing the exam.
mm, you
Yeah.
already passed DCH in 2021
Yeah,
November.
ma'am. Yes, ma'am. Yes,
So
ma'am.
in 2021, you passed AKP in January, right?
Ma'am, yes, ma'am. Jan, yes, ma'am.
January. So you
Yeah.
almost prepared for 2.5 years.
Yes,
Then
ma'am.
you prepared, then you got not 2.5 years, 2 years. You just
Yes,
prepared
ma'am.
2 years for clinical exam.
Yes, ma'am. Yes, ma'am.
In that 2 years, you passed another exam, that is DCH clinical. So that
This
helped a lot, isn't
Yes,
it?
ma'am. Yes,
Yeah.
ma'am. DCH helped a lot, ma'am, because it gives you a rough idea about how this MRCPCH clinical will be.
Mm,
Yeah.
mm,
Yes,
yeah.
ma'am.
So yeah, that definitely helped you. I
Yeah.
can guarantee that
Yes,
whoever
ma'am.
have given DCH clinical UK exam, now
Mm.
the blessing is it is still online. Although MRCPCH has come back to offline stage,
Yes, ma'am.
but DCH is still online because they are getting the RCPCH actually, if RCPCH started face-to-face DCH, then people are
Mhm.
less interested.
Yes,
Because
ma'am.
for traveling DCH exam to UK doesn't make any sense, isn't it?
Yes,
Because
ma'am. Yes.
this will not give you GMC registration. So
Yes, ma'am.
that's why actually people are more interested in offline DCH exam rather than, sorry, online DCH exam rather than offline DCH exam. Yeah.
Yes, ma'am. Yes, ma'am.
So
Yes.
that, yeah, I understood your journey now. So
Yes, ma'am.
this DCH helped you a lot for
Yes,
preparing.
ma'am.
And let me tell you and other audiences that Dr. Nivetha, from beginning of my batch, she joined in, I think, December, right? Dr. Nivetha, you
Yes,
joined
ma'am.
December,
December. Yes, ma'am.
and her exam was in February. So she just got 2-month classes. But
Yes.
from the very first day, she made me clear that, Madam, I have exam, so you have to help me. And then I gave her all the classes that she missed, recorded every day I gave, because I'm also very busy. I do not take everyday class. I take like two class or 3 class per week. I don't have that much time actually, because I'm working in UK full time, 8 a.m. to 5 p.m. So that's why for me only Saturday, Sunday is free. Otherwise, it's very tough for me. So I take very scheduled class. I don't have haphazard class. And I mainly give importance to mock. My students, actually, whoever passed, my success rate is almost 100%. Failure rate is nearly nil for my clinical, because whoever gave exam, whoever admitted to my batch, I made them clear that you have to concentrate on mock, and your mock will be 100% like exam oriented. You cannot make, I mean, you cannot give mock like, casually. You have to give it formally. So that is why what my students, actually my colleagues or students who are make sure from the beginning. So Dr. Nivetha was very obedient and very polite, and I will say very, she was always asking my advice that, Madam, what should I do next? What should I do next? So she was very obedient, and she was very sincere, sincere to her study. And you did not do any job, right, Dr. Nivetha, for past few
And
months?
no, ma'am, I not because
Yeah,
newly moved to UK, ma'am. I
yeah.
didn't get any job.
So that was a blessing for you, actually, Dr.
Yes,
Nivetha.
ma'am.
Those who are actually working. So for them, it's very difficult to concentrate on study, and then,
Yes, ma'am.
yeah. So Dr. Nivetha, which book you read
For
for?
clinical, ma'am.
Hmm.
Ma'am, for clinical, first, I followed the Malaysian book,
Mm-hmm.
and then
Secret of clinical
yes,
education.
ma'am, Secrets of Clinical. Ma'am, first exam I already had prepared, so I'd written the history, I mean, clinical format and kept, ma'am. So
Mm,
first I used to go through the format once,
mm.
and then the Clinical Secret was one main book, and the other book was this one, ma'am, which is that?
Mark Betty.
Yes, ma'am, Mark Beatty.
Mark Betty. Mm,
Yes, ma'am. This both was the main exam, I mean, main books which I followed.
mm. Okay.
Yeah. And then your class notes, ma'am. That's it.
Yeah. So people, the audiences, you can ask question, okay, beside typing, because for me, typing question and answer is very difficult. So you can ask directly to Dr. Nivetha. You are open for this is
Yeah,
open. Mm.
Dr. Nivetha, I just want
Yes.
to ask one thing. Did you
Yeah.
appear in UK for clinical or in India?
In UK.
Okay, great.
Yeah.
But
Thank you.
congratulations.
Thank you so much.
Uh, just I wonder, hi, congratulations, Dr. Nivetha.
Thank you so much.
Yeah, but I wonder, any, is it necessary to do DCH? What's the benefit of DCH?
It's not completely necessary to do DCH before MRCP-CAH clinical, but by doing DCH, you get to know the format of MRCP-CAH clinical.
Mm-hmm.
Yeah, you get an idea about communication, about clinical,
Okay.
about all of that.
Mm-hmm.
Because
Thank
both the exams are UK, both
Yeah.
the exams are UK examiners, and their format is same, almost same, except
Yeah.
few session. So when you give exam with the UK examiners, you can get a clear idea that, okay, this will be my communication, this will be my history. And
Mm-hmm.
moreover, it can give you confidence. You can prepare for any exam. So when you prepare for one exam, definitely another exam becomes easy, right?
Yeah, right.
Mm.
Mhm.
Okay, any more question, anyone, or we will go directly to the stations of Dr. Nivetha?
I have one question.
Mhm.
I'm just wondering if you appeared for it in UK and you weren't working here for the clinical stations, how were you able to practice?
Tell Dr. Nivetha
Um,
how you
yes,
practice.
ma'am. So, like for the past, I mean, like past 1 year, I'm not working. So I did not practice for the past 1 year, but it was the practice which I had before. So I've been working in the pediatric department for 3 years. So you
Okay.
get to see a lot of cases, and
Yeah.
yeah, so that helped me a lot, I think.
Because I have heard that if you appear for it in UK, then the cases and the syndromes are different as opposed to, for instance, if you appear for it in an Asian country. That is why I'm wondering if this is important enough or not.
If you're working in UK, then it's even more easier. But it is not like patients are different here. Once you get to know about, you learn about the cases and all that, it's easy.
All
It's
right.
not that hard.
All right. Thank you.
Yeah.
And one thing, Dr. Nivetha, how you practiced in our course, the
Yes.
clinical
Yes.
stations.
Like clinical stations, usually ma'am used to give scenarios. She used to put photographs of patients. So
Mm,
you
Oh,
have to see that and you have to present. So it's the same way which is going to happen in the exam also. You
all
have a
right.
patient in front of you and you have to see the patient, examine the patient and comment on what you see.
All right. Thank you.
Yeah.
mm. Okay, okay. Any other question about any center? Some people have question answer. So we gone question answer before Dr. Nivetha's station. So it's okay. You can ask any question to Dr. Nivetha or me about the center, about the exam format, anything. Because today is our station is two part. One part is Dr. Nivetha's station. Another part is question answer. Like some people asked me in the group that, Madam, I am getting a seat in Singapore. Should I take the Singapore seat or not? What will be the question format? Singapore is face to face now. So the question format is same as UK and other country. But I will say my personal experience and my personal colleague, whoever are my colleague who pass from Singapore center, I would say Singapore center is a very sophisticated center. I mean, India center and Nepal center, Pakistan center, Jeddah center, they have a pattern because they have a pattern. I mean, the examiners are almost same, but Singapore center, they are following strictly UK pattern. So if you booked any exam in Singapore, be prepared that cases are almost same as UK. Okay, most of the examiners are UK based, and the standard is just like UK. So if you compare MRCPCH clinical, the world, one world is UK world, another is non-UK. So I will say that Singapore center, Malaysia center, and Hong Kong center. They are following mainly UK because, there is a reason behind. The reason is they do not have MD, FCPS like our exam. Their main exam is MRCPCH. Malaysia, Singapore, Hong Kong, they have main exam is MRCPCH. So they, from the beginning of their country, they follow the UK rules, UK pattern. So if you are preparing for Singapore, Malaysia, or Hong Kong center, you may get a seat now because COVID has been withdrawn. So you may get a seat now. And the pattern of exam systems are same as UK. So be prepared that you are going to UK like that. Am I make it clear? Did I make it clear?
Yes, ma'am.
Yeah, anyone
Uh,
have any more question about anything, or we will go
yeah, like
direct?
we see the slots are very difficult to get for clinicals. How
Mm-mm.
easy is to get a slot in UK if we are already moved to UK?
Yeah, if you
Obviously,
are
they must
already
be
in
having more
UK,
seats.
then it is easy, more easy than overseas, because for overseas you need a visa. That's an issue. But for UK, you don't need a visa. So if you are already in UK, they will give you seat more rapidly.
Okay, right.
Mm.
Thank you, ma'am.
And one more thing, in UK, exam is conducted 3 times a year.
Mm.
So the possibility for you to get the slot is more.
more. Other than other countries which have 2 centers per
Yes, ma'am.
year. Nepal has only 1 center. Some
Mm.
India has only 1 center. Some part in India has only 1 center. So per year, yeah, that's very okay. We will take question in between, but let us start with, because it is Ramadan, so everyone is fasting here. So Dr. Nivetha, what is
Yes, ma'am.
first clinical station 1? Can you tell me?
Yes, ma'am. My clinical one was CNS, ma'am.
Mm,
It was a 2.5-year-old.
okay,
They asked me to do a cranial nerve examination.
okay.
So this was the comment when I entered the station.
Mm,
The child was otherwise normal. Child was pink. Child was walking. Gait was normal. There was nothing in the surroundings. So I started my cranial nerve like first, second, third, and all that, ma'am.
mm-hmm.
Yeah, and actually this was my last station, ma'am. Clinical one was my last station. So
Okay.
I was quite already exhausted and all. And then once I finished, I mean, cranial nerve one, I just asked the patient to close the eyes and I was counting the fingers.
Mm.
But then the examiner pointed out the Snellen's chart to me after I finished my examination. So that is
There
where I
was
lost my mark. There was a Snellen's chart. Yeah.
Snellen chart you did not notice, right?
Yes, ma'am.
So
I didn't notice that
whenever-
one.
yeah, whenever there is cranial nerve, please look at the room. This is my advice. Please look at the
Yeah.
room surrounding. So in the surrounding, I taught Dr. Nivetha that look at the surrounding,
Yes, ma'am.
4DSP. That was our motive, but she missed this Snellen chart. It's obvious because during exam stress, you are tired, you are exhausted. It's obvious. So
Yes,
stress chart missed, and see, for this examiner cut 1 mark because you have to know that
Hmm.
Snellen chart is for visual acuity.
Yes, ma'am.
And for field of vision, there should be finger confrontation test or red pin
Yes.
confrontation. So you have to look for this instrument in the exam hall. Yeah.
Yes, ma'am. And then as I went for this olfactory, I just asked the mother the question, ma'am, was there any concerns about smell and all that? Because
Mm.
there was nothing like a soap or anything to test the smell. And as I moved for the 8th cranial nerve, and all, the examiner itself commented, no, everything else is normal.
Okay. So
Then
which nerve the child had difficulty?
no, ma'am. Then after that, he asked me about the findings. So I said I did all the cranial nerves, everything looked normal. He said, yes, everything is normal. This child had a focal seizure. So our discussion will go in that part.
Mm.
So this case was a focal seizure case, but they asked me to do a cranial nerve examination, which everything was normal. They just saw me if I was doing everything.
Okay. So that means the station you got in clinical 1, that was a cranial nerve examination,
Yes,
but
ma'am.
there was no complaint. The
No.
examiner just asked the examiner just asked a normal child, right?
Yes, ma'am. Normal child. Otherwise, normal child.
So they just followed the rules of the
Yes, ma'am.
clinical exam, right?
Yes, ma'am.
Okay,
Yes.
very good. Okay. So you missed Snellen chart. Anything else
Yes.
you missed in this station?
No, nothing, ma'am. Then my discussion started about focal seizures.
Okay, focal seizure. What was
Yeah.
the discussion?
Ma'am, a discussion was initially like, how will you approach this child?
Oh, okay. How did you answer?
So I was like, initially, I'd like to take a complete history from the mother, do a complete cranial nerve and CNS examination. And then the examiner asked, okay, what investigations would you like to do? I said like, I would like to do an MRI because it's a focal seizure to see if there's any tumors. Then I said everything, ma'am, but here I forgot EEG because the examiner prompted me there. Is there anything else? He asked. I was just wondering. Then he himself said, would you like to do a ECG? EEG, sorry. I said yes.
Got EEG for focal
I
seizure.
forgot EEG, yes.
MRI EEG should not forget in
Yes.
case clinical stations, clinical neurology station, yeah.
Yeah. So that was the thing, ma'am.
Okay. Any other point you missed in this station?
In this station, ma'am, they asked me what other investigations. I said metabolic workup, but they commented like that was not necessary over here.
Yeah, it is a focal seizure. So metabolic is not a focal seizure. If it is metabolic problem, it will be generalized tonic-clonic seizure or generalized seizure, not a focal seizure. Focal
Yes.
seizure is only structural,
Yeah,
and metabolic is mainly functional. So
yes,
yeah.
ma'am.
Okay, very good. Very good.
So,
Yeah.
This was the
Anything?
first station, ma'am. That's all, ma'am.
Second station, clinical second.
Clinical second was this one, PGALS.
Yeah, anyone has any question, you can ask. Okay, Snellen chart if the child can follow the command, okay?
Mm.
A 2.5-year-old cranial nerve exam, they will never give. What is the age of the child, Nivetha? What is the age of the child?
Ma'am, I've written it as 2.5. I think more than 3 years, ma'am. I'm sorry, I've written the age wrongly, I guess.
Can it follow the command?
Commands? Yes, ma'am. The child was able to follow the commands. Yes.
You forgot the age, right?
Age,
Snellen
yes,
chart,
ma'am.
I think Snellen chart above 3-4
Yeah,
years, huh?
I think so, ma'am.
Right?
So he could follow the command as Dr.
Yes, ma'am.
Nivetha said.
Yeah.
Yeah, so it will be more than 3 years
3
actually.
years. Yes, ma'am.
Okay. Next station,
Yeah.
next clinical 2.
Next is
I just wonder, even focal seizure without element of a neurological deficit. And after focal seizure, I examine the patient. He doesn't have any focal deficit. Is it necessary to do brain MRI, doctor?
no, and the examiner said this is a case of focal seizure. What investigations would you like to do?
Okay.
Yeah.
Part of the focal seizure is MRI. Yes, you have to
Yes.
understand it is a structural
Yes.
problem.
Yeah.
Like it can be a case of, tuberous sclerosis. It can be a case of anything. It can be a case of tumor, vascular. I taught
Yes.
them in the vitamin mnemonic local.
Yes, ma'am.
Yeah.
Yes.
Okay. Next.
Next was PGALS, ma'am.
Yeah. What was
This
how was
was
the age of the child?
yeah. This was a 5-year-old girl. So initially when I entered, they said me that this is a 5-year-old girl with oligoarthritis. On follow-up, please do a PGALS. This was my comment.
Okay. So 5-year-old P-girl, right?
Yes, ma'am.
5-year-old
Yeah.
P-girl. Okay. Oligoarthritis.
Oligoarthritis.
They told already?
Yes, ma'am. They said me already. It's oligoarthritis.
Girl,
Oligoarthritis.
it was girl.
Girl child. Yes, ma'am.
So how did you, how did you do approach and
And they told me that PGALS of the lower limb. They mentioned that also to me, ma'am.
Dr. Nivetha, open your mic. I'm making on. Open your mic, please.
Okay, ma'am.
So
So they mentioned PGALS of the lower limb also. They gave me that comment also.
Lower limb, right? Okay.
Lower limb, yes.
Lower limb. Okay. Then how you approach or how did you do?
So same, I started with gait looked normal. Then on inspection, the child had a nice prominent swelling of the left knee.
Okay.
So I went on that approach.
Okay.
Look,
So
feel, move approach.
Yeah,
Local
local approach. Yes. Yeah, very good. You did very systemic. See, whenever you do systemic approach, system-wise clinical, then it's very easy to pass. Yeah. Then
I did look, feel, move approach. I compared both sides. She was able to do. She didn't have much pain. Then I asked the examiner, should I do the PGALS of the upper limb? He said, yes, you can continue. I did PGALS of the upper limb. And then I had a comment. There's a fundoscope over there. Please examine the eyes.
Oh, okay.
But here I missed, ma'am, because I didn't know.
You didn't know fundoscope, how to hold fundoscope?
No, ma'am. No, I examined the fundoscope, everything, but I could not find the findings over there.
But you could see the redness of the eye, right? If
yes, ma'am. I could see that. Once they said fundoscope, I got a little bit tensed inside the examination.
Okay. So remember that.
And do you examine the patient with the ophthalmoscope?
Yeah, I examined the patient with fundoscope. Yes.
Very well done.
They can ask you anything in exam. So
yeah, like last exam with Dr. Renuka or Dr. Mithuna, they gave 8, 10 growth chart. For you, they gave Snellen chart, fundoscope. I mean, what the hell? Okay. Then.
And then I got a comment saying, did not pick up the difference between both the eyes and did not comment on the uveitis.
Yeah, of course, redness of the there. If you miss uveitis in oligogia, that will definitely cut your mark. Yeah.
I just said them that there's a high risk of uveitis, but seeing the eyes, I did not comment on that, ma'am.
You said high risk, right?
High risk of uveitis, yes.
There will be irregular margin of the pupil that can be easily visible.
Yeah.
Even if there is no redness, okay, irregular margin pupil will be easily visible. And that is a very dangerous sign for uveitis.
Yes, ma'am.
Anything?
And then questions went on arthritis, ma'am, like management, about the drugs,
Investigation and management.
investigation. Yes, ma'am. Has normal, ma'am. Yeah.
Okay, okay. So that you said about the
Yes, ma'am.
primary drugs, painkillers, then
Yes.
disease modifying drug, biological agent, right?
Yes, ma'am.
Surgical,
And yeah, and teams involved, ma'am.
yeah, teams are very important. Yeah. Anything else?
Sure, that's all, ma'am.
Okay, thank you. Next, clinical 3.
Next was they've asked me to do a general examination
Mm,
of a 2-year-old child. This was
very
my comment.
okay. How did you approach?
Yes, otherwise the child was fine. The child was with mom, and then I examined everything, ma'am. There was no dysmorphic features, and child. I asked if there's any concern with gait, nothing. But I could see an insulin pump alone with the child. I saw an insulin pump alone.
See, in the surrounding, they gave anything, right?
This insulin pump was attached, ma'am, to the child's abdomen. So this was the only thing which I saw in that examination, nothing else.
In the surrounding, was there anything like RBS monitoring or something?
No, ma'am, nothing was there.
Okay. And then what question they asked and how did you approach?
So I started with my examination saying this is a 2-year-old, otherwise normal child. I can see an insulin pump. So the child is a diabetic and on insulin. And then my questions were like, what type of diabetes you think this is, type 1 or type 2?
Okay.
I said most commonly it's type 1.
Okay.
And my discussion went in diabetes, ma'am, like how will you approach this child? I said I'll examine the child. I'll take a complete history. And all the teams involved over there.
Okay.
And then I'll ask about I'll counsel mother about if she's using the insulin pump correctly.
You gave advice.
Yeah, yes, ma'am. Advice.
Hypo.
Yes, ma'am. And about screening for other autoimmune disease.
Very good. Yeah.
So here I got 7. They minus 1 mark for me because they said that I missed the injection sites.
Oh yeah,
I didn't comment on the injection sites.
I teach you many times hypertrophy.
Yeah, I forgot. Yeah.
Hypertrophy, very lipoatrophy.
Yeah, I didn't comment on that. They said me, ma'am.
That indicate that mother is using insulin properly. Okay.
Yeah.
But this child, Dr. Nivetha, you could defend yourself that, sir, I did not find any hypertrophy site because the child is very small, number 1.
Okay, ma'am.
Number 2, the child is using insulin pump. So in case of insulin pump, they don't have any atrophy site because it is going through pump. But yes, pump site should be changed. Yes, pump site should be changed, like from one side to another side, from right belly to left belly, to right thigh to left thigh, to right arm to left arm. They should be changed. Yes.
Yeah.
You should look below the pump. You did not look, I think. You should look below the pump. Yeah.
I didn't
because
do that.
you have to change the insulin pump site. Yeah.
Yes, ma'am.
That is very important. Missed the insulin pump site. Missed. Yeah. Anything else? Anything?
That's all, ma'am. That's all.
Oh, very good. So this station was difficult, Dr. Nivetha, and you did well. This was a 2-year-old with diabetes pump. It was difficult. Okay.
Yes, ma'am.
Then clinical 4.
Clinical 4 was again a general examination station.
Anyone has any question before we jump to the clinical 4? You can ask any question to Dr. Nivetha or me. Anything. Okay. Yeah, Dr. Nivetha. Yeah. What was the station? CVS?
Not CVS, ma'am. Again, a general examination. I didn't get CVS at all.
Why? Oh my God, you did not get CVS.
Mine was like cranial nerve,
cranial nerve, yeah. But
abdomen, nothing came, ma'am.
we did all the stations, general exam, clinical, right? We did in our course, we did the cranial nerve, general exam. Otherwise, it would be terrifying.
Yes, ma'am.
So this child, how was the age?
This was a 14-year-old child.
Oh my God, 14-year general exam.
Yeah. So this was my comment, ma'am. 14-year-old do general examination.
Okay. Girl or boy?
He's a boy.
Anyone has any question, you can ask because I am not able to see the chats.
Ma'am, I have a question. Dr. Nivetha, congratulations first of all. So I have a question that during examination approach, do examiner interrupt during the examination procedure? Or
No,
you
they
just-
do not.
Okay. And one
Once-
more thing is, yeah, sorry.
Yeah, they do not interrupt you.
Okay. And one more that do you give running commentary during examination procedure or you just do silently?
No, so for this child, I just see and I just tell like, have you brought anything with you around the room? Okay, I cannot see anything. Then when I saw the pump, I said, oh, I can see an insulin pump like that.
Okay.
I just did that.
Okay. And that comment, you don't do eye contact with the examiner. You just talk
No,
and
I just,
examine.
I just talk with the patient. I examine the patient. Once I'm done, I turn to the examiner and I say I'm done. And then they say, okay, comment on what you see.
Okay. Okay. Means summary of
Yeah,
your
summary.
examination process.
Yeah,
Okay.
yeah.
Okay.
Ma'am, I
Thank
have
you.
a question, ma'am.
Mm-hmm.
This is Neha, ma'am.
Yes.
Ma'am, I wanted to ask, is it better to give running commentary while doing the examination, or is it better to just say everything in the end?
No, don't give running commentary in the face-to-face exam. Running commentary is for online exam, not face-to-face.
Okay,
Yeah.
okay, ma'am. Thank you.
Hi, Dr. Nivetha. I have a question.
Yeah.
Okay, Dr.
So because you are not working for the past
When you-
1 year,
Dr. Vinodini, your voice is very far away. Can you open your mic correctly? I mean, remove the headphone.
yeah, sure, ma'am. Can you hear me now?
Not clear. Dr. Nivetha, can you hear her?
No, ma'am.
Hello, can you hear me now?
Yeah,
Yeah.
now, yeah.
Yeah, thank you, doctor. So actually, you told you are not working for the past 1 year, and in the application, usually they'll ask, right? What is your current working place, like that? So it is a mandatory thing, right?
So,
we have to-
yeah. No, I feel that currently I'm not working.
Okay.
Yeah.
So is there an option like that?
Yeah, you can just type it.
Yeah. Okay.
There is option for you to describe your situation.
Yeah.
Okay. Okay.
For
So I thought
MRCPH
we should
exam,
work, then only we can write the clinicals, I thought. So that's right.
No, your past work experience is there, right? So you have to fill that also.
Yeah.
there is past work, there is future
Yeah.
work, there is current work. Yeah.
Yeah.
Currently, you can say I'm not working because I moved to UK. You can write in detail.
Yeah.
I'm in the maternity leave, or I'm in the paternity leave. You can write down whatever you want.
Yeah.
Okay. Okay. Thank you so much.
Yeah, welcome. So this was a general exam. What was the case, Dr. Nivetha?
So 14-year-old ma'am. So once I told him to remove the shirt, I could see scoliosis.
Okay.
And then I asked him to bend. I examined the scoliosis. It was pathological.
How suddenly you found scoliosis? What approach you did that you
Ma'am,
found
yeah,
scoliosis?
first I saw the gait. Gait was normal. And then otherwise, then since it's general examination, he was full dressed. I asked him if he could just remove his shirt. So he removed his shirt. I could see scoliosis, and there was pectus carinatum, ma'am. It was very visible.
Okay.
Yeah. And then on examination, I can see numerous caffeole spots. Then it went like neurofibromatosis. I can see axillary freckling.
Okay, so it was a case of
Neurofibrosis.
neurofibromatosis.
Nivetha, I would like to interrupt a little bit. First of all, congratulations
Thank
for
you.
your brilliant result. And I have a little query regarding the clinical station 4.
Yeah.
You were asked to perform general examination, right?
Yes.
Then you just narrated that you started with the gait while after asking the child to remove his shirt, when you noticed scoliosis, did you start with gait examination or went through the general examination approach?
No. So initially, when I started my examination, I didn't ask the child to remove the shirt. So I wanted to first examine the gait. So first I asked the child to walk, and then I asked him to remove the shirt. So once he removed the shirt, I could see pectus carinatum, and then back I could see scoliosis.
Okay. So before making him walk, did you ask him the 3 questions that we usually ask before performing PGALs?
No, this was not PGAS. This was general examination.
Yeah. No. As you started with it, so I had a query. That's all.
Okay.
Thank you.
Okay. Yeah.
Okay, so it was a case of neurofibromatosis.
Yes, ma'am. And then since the child had scoliosis and pectus carinatum, I did a RS examination also.
What is
I
that?
just auscultated the thing, ma'am, if the child has any restrictive lung disease, something like that.
Respiratory, yes.
Yes, ma'am. And then I examined the abdomen, and then I presented my case. So this was neurofibromatosis. And then the approach was according like how would you approach this case? What management would you like to do? Who are the teams involved?
So teams are very important, huh?
Exam. Yes, ma'am.
Then how will you approach? Approach means taking
history, yes, ma'am. Examination,
investigation of the child, everything they will ask. Yeah.
Yes, ma'am. So I said here, since the child had scoliosis, I said X-ray of the spine to know the corpse angle.
Investigation are very important.
Yeah.
X-ray,
And then
lung disease, restrictive lung
yes,
disease.
ma'am. Then I said spirometry.
Lung function.
Yes, ma'am. So this station was that one.
Any mark they cut? They cut
No,
any
ma'am.
mark?
I got full 8 over here.
Full 8. Very good. You did not miss anyone. So we finished 4 clinical stations to Dr. Nivetha. Now let us go to video. Anyone has any question? Please ask about clinical stations. Okay, Dr. Nivetha, yes, please start.
Yes, ma'am. So this video was...
Dr. Nivetha, sorry.
Yeah, sure.
I'm congratulations, Dr. Nivetha, first.
Thank you.
Yes, Dr. Nivetha, I want to ask, it was a case of neurofibromatosis. Is there any other stigmata of the neurofibromatosis like neurofibromas or anything else you saw? Or...
No, I could just see only Caffioli spot, and I could see only axillary freckling, only this along with scoliosis.
Okay. Thank you, doctor. Yeah. So major criteria you found, right?
Yes.
Yeah. Okay. Thank you.
Okay. What is the video station, Dr. Nivetha?
This was without sound, ma'am.
Without sound. Okay. What video?
This was a 12-year-old girl. They were focusing only on the abdomen. There was I could see some rashes, but this video was not full clear, ma'am. It was little blurred, but they were focusing only on the rashes. And how it was is there was injury marks surrounding that. There was rashes.
Is it dermatitis artifacta, something like that?
Yes, ma'am. This was self-injury. Yes, ma'am.
Just before exam, just before UK exam, if you remember, we did self-harm.
Yeah. Yes, ma'am. Yeah.
Dermatitis artifacta, self-harm. What are the causes? What are the differential? Yeah. So it was self-harm. What did you say, and what did they ask you?
So they asked me like, what do you see in the video? So I said, I just explained what I could see. And then I said, I want to know if it is blanching or not. Then they asked me the differentials. I said, if it's blanching, this and all are my differentials. Then I said, I can see some scar marks. So I'll think about self-harm also, dermatitis artifactis. So since I said that, they stopped me there because that was the answer.
Okay, very good.
And then they asked me about like what history would you like to take? What examination? And then
is it a typical question?
Yes, ma'am. Typical questions, yes, ma'am. And then in management, they were asking me next, but when I said CAMS, they stopped because they got the answer what they needed.
Okay.
Yeah. So this was typical, same like questions what they usually ask, ma'am. But so they were focusing only on the abdomen. The rashes was only on the abdomen, ma'am.
Dermatitis artifacta is approachable for any part of the, any part of the body. It is actually approachable rash. It can be on the thigh, it can be on the abdomen, it can be on the upper arm, whatever the area, the child is approachable. That is the dermatitis artifacta. So it can be, you will find it anywhere in the body, especially in the front part, because back part, the child cannot go in the back.
Yes, ma'am.
So when you said CAMS management, he stopped you. Anything else?
Yes, ma'am.
Or anything else?
No, ma'am. This was a very short discussion. It was straightforward, and yes, ma'am. I finished it early also, ma'am.
Yeah, when you finish the early, and examiners are happy, satisfied, you will understand that you passed.
Yes, ma'am. Yeah.
You will understand then and then. Yeah.
Yes, ma'am. Yeah.
Okay. If anyone has any question, please, you can ask Dr. Nivetha. We are going a little fast because Ramadan is here. We have to go home. Yeah. So next, Dr. Nivetha, next video.
Ma'am, next was they were showing a newborn baby who was cyanosed. And this was a video of this congenital cardiac heart disease, ma'am. They were showing the saturation, I mean, pre-ductal and post-ductal saturation.
Mm.
And they did one more thing. They auscultated the pulmonary area, and simultaneously they auscultated the back of the chest, and you could hear a murmur over here, a systolic murmur.
Mm. So back was radiating, right?
It
Back
was
radiating.
radiating. That means it's radiating. Yes, ma'am.
That is pulmonary stenosis murmur. Yeah.
Yes,
Okay.
ma'am.
Okay. So they are
Then,
in the video station also. You will
yes,
get clinical. You will get clinical cases. So clinical cases are very important, especially cardiovascular. Dr. Nivetha, you know why they
yes,
did not give you cardiac station in your,
because
because there was video in cardiovascular.
yes, ma'am. Yeah, correct.
Yeah.
Yeah.
Okay, next.
So this was this, ma'am. Unusual questions, ma'am, like what are your differentials?
Like, what did you say? What
Ma'am,
did you
first I just explained everything, and I said this looks like a cyanotic congenital heart disease. Then I said, since I can hear this murmur, which is a pulmonary stenosis murmur, I think most commonly it could be a TOF.
Mm.
Then they asked me like what questions you want. Like I asked about antenatal history, all that I said, ma'am, history, investigation.
Okay.
Then management, they wanted me to tell prostaglandin. I did tell that.
Yeah, that is very important
Yeah.
because drug-dependent lesion and newborn
Yes.
cyanotic. So they
Yes,
wanted
ma'am.
to hear prostaglandin.
Mm.
Very
And involvement of teams, ma'am, like cardiothoracic surgeons,
mm, mm.
the NICU team.
So you are just appropriate answer you gave, and
Yes,
that's
ma'am.
when
Yes,
you
ma'am.
give appropriate answer, they are not bothered about you. And video stations are quite smooth.
Yes,
Video
ma'am.
stations are quite smooth. If
Oh.
particularly if I always tell my students that read guidelines, they read guideline, maximum guideline they read. So yeah.
Yes, ma'am.
Investigation management is prostaglandin. Anything else? Any other? You got full mark, right? In video
Yeah,
station.
here, yes, ma'am.
Any question? Anyone?
I have a question. Is TOF is a duct dependent lesion because there is a VSD in TOF? So
No, she did not mention TOF is a drug dependent. She mentioned this patient management is
Yeah.
prostaglandin.
overall cyanotic disease, like
Yes,
Yeah,
yes.
yeah.
It can be drug dependent. That's why she
okay,
mentioned it can be
okay,
drug dependent.
okay. Thank
They
you.
wanted to hear about prostaglandin actually, that in a
Yes.
drug dependent lesion, you will give prostaglandin. Cyanotic baby in a newborn, what can be the cause? Critical pulmonary stenosis. In critical pulmonary stenosis, you have to give prostaglandin. What Dr. Nivetha said, what is the DD of this child? So Dr. Nivetha said early presentation of TOF. TOF is a drug dependent lesion. Yeah.
Okay, thank you.
Yeah, most welcome. Okay, Dr. Nivetha, next. Communication. Anyone have any question? Okay, yeah.
Yes, ma'am. This was like a talk to mom of 4-year-old child with constipation and soiling. And the question went like, mom is concerned that constipation and the child had some behavioral changes after the child met the dad or was with the dad.
What does it mean? I did not understand it.
I mean, mom and dad are not together, ma'am.
Separated, okay.
Separated. This child, mother's mainly concerned about constipation and soiling. The mother says that this constipation increases and the child is having some behavioral issues after coming back from the dad, after meeting the dad or something like that, ma'am.
So what is your task?
So my task is to just speak to the mother and just address her concerns.
Oh, so what was mother's concern about? Why? What is the
So,
cause of
yeah.
swelling?
So initially, since they said after meeting the dad, I have outside the station, I thought, can it be something like an abuse or something? So I went inside and I started speaking with the mom, and she started saying that this constipation and soiling is too much. And then I just made a thing like, do you have any concerns that the child could have been harmed by the dad? She said no. And then her main issue over here was the child was not eating proper fiber diet, not taking medicines properly. Otherwise, she had no other concerns, ma'am.
What medication?
I mean, I think...
Movie call?
Yes, ma'am.
Okay. So mom's concern is the child is having some behavioral issue after meeting with dad. So how this conversation went? I mean, was it very difficult conversation? Or
Ma'am, no, the mom was not, it was not a very difficult conversation because I asked about the dad also. The mom mainly said that he's not taking his medicines properly and he's not, then I just asked if he's having high fiber diet. She was like, no, he's not eating properly. So I said I could refer them to a dietitian for this and I can examine him once again.
Okay.
But I have to just read the comments on this, ma'am, because I could not understand anything. This was quite hard for me, ma'am.
Okay.
Yeah.
So what was mother's concern? I mean, how the conversation going on?
Yes, ma'am. The mom's main concern was the child is not taking the medicines properly. I mean, the Movicol, and not having proper the high fiber diet, not following that one.
Not
Yeah.
fiber diet, no fiber diet.
Yeah.
Okay.
Yeah.
So you gave advice, isn't it? So it's
Yes, I gave advice.
It's actually information giving scenario, what I understood from your information giving scenario, that you have to just address mother's concern and
Yes,
answer appropriately. Just this.
Just this, yes, ma'am.
So anyone who does not know about constipation guideline, he will stuck actually here. He will stuck because constipation, one of the cause of constipation is child abuse. Child neglect. This child is a neglected child, definitely. Mother is not giving proper diet as mother is, but child is not taking proper medication. So this is a neglected child, definitely.
Yes, ma'am.
Yeah. Okay. And behavioral issue is there. So it can be ADHD, ASD. It can be.
Yes, ma'am.
Okay.
I have one doubt, doctor.
Yeah.
How can I hold a communication and not taking a history? Here, all we are the beginners. We are afraid to convert the communication to history taking.
This is a very good question, actually. Dr. Nivetha, answer it. How you prevent yourself from taking history to going.
So I just asked the mother, what are your concerns?
Yeah, she did not ask, can you tell me how about his feeding? Can you tell me? She did not ask like that.
Didn't like that, yeah.
Yeah.
Then
So
since
what is your concern?
Concerns. And since I had a thought about abuse, I said that, what do you think about his dad? So do you think he could have caused any harm? So she said, no, he's a very good man.
Very, very good man. So yeah, so that actually ruled out the abuse by father. Yeah.
Yeah.
Okay. Any other question? So actually,
I have one question.
Go on.
What were your comments on this station? Were they satisfied with your information giving?
No, I got 6. They cut my marks, but the comment I could not read it properly. I mean, I can send it to ma'am.
No, wait. I'm reading your comment from the mark sheet you send me. Wait. Just give me 1 minute. Yeah, ask your question. I'm reading the comment. Ask your question, please.
I'll open the mark sheet in my phone.
No. I'm reading your comments.
I had a question regarding this Form 1 station. Here, the scenario was given that the mother had concern. Then how the communication was proceeded? Like, first of all, you asked for the concerns, and then you the child abuse was ruled out, as the mother stated that father was a very good person. Then how you continued?
Yeah, that's what I asked her. What are your main concerns? So she said me that her concerns were about the diet and medicines.
Dr. Nivetha, you have 2 communication.
Yes,
One communication comment was clear explanation.
Yes,
so that you got full mark in communication A.
Okay.
And in communication B, you cut mark. You have enough knowledge. Okay. You have enough knowledge to, and accordingly next step, but you made mother feel like bad people. Bad people or bad something. You made mother feel like bad parent. Yeah, you made mother feel like bad parent. Did you do like that?
Ma'am, I said it's not your fault. for constipation and so.
Oh, poor baby. It's not you. It's not
Yes,
you.
ma'am, your fault.
It's not your fault. Okay, okay. Does not want practically doable suggestion. Would you didn't to, oh my God. Oh my God. More, his handwriting is so clear, but
We can't
but
understand.
I can understand, yeah. But uh, there were involuntary play therapist. What is that? Community involuntary play therapist? Community nurse will. Oh, so you did not refer to the community nurse, okay?
Okay.
There is a play therapy for toilet training in the nursery, actually. You did not involve those.
Okay, ma'am.
You have to involve multidisciplinary team as well as school, okay? Mother failed. So there is a community nurse who help actually in toilet training.
Yes, ma'am.
Mm. Is my background very noisy because it's raining? It's very
No, ma'am.
noisy. Okay.
No. Clear background.
Okay. So, okay. So here actually, Dr. Nivetha's that's why, candidates, I always tell in my meeting that you think communication is very easy, but actually this is the most tough station, because when you come to UK, you understand that how important is communication skill. I mean, talking to any person, any colleague, any senior or any junior, or any patient, parent, or nursing staff is very difficult sometimes. So Dr. Nivetha is very polite. I know her personally. She's very polite and she's very excellent doctor. She's nice doctor. But even then, when she talked with the mother, examiner felt that she made mother as a bad parent. So in that case, actually, they will cut your mark. If you felt, even Dr. Nivetha told the mother that you are a very good mother. Even then, examiner comment that. So that means she must say something that was not appropriate. So appropriate language, using appropriate language is very important in communication. And people got 0. I told you already, people got 0. Many people got 0 in communication. That means what? 0 knowledge about communication. Okay, so any other question? Dr. Nivetha actually did not involve the multidisciplinary team.
Yes, ma'am.
Okay.
Play therapist.
That is the
Dr.
main reason.
Nivetha?
Yeah.
Yeah, I have. So was the history mentioned like the child had autism, something like that?
No.
Or just
Behavioral
one
problem.
component?
Behavioral problem.
Okay. Is there like recent incident adjustment disorders and like but you didn't ask about when he's soiling at only when he sees the father. That's it. You straight away skip through the history for the history of trauma. I mean, like abuse.
Yeah, yeah. I didn't ask about that. Yeah.
You didn't ask anything about dietary. You just mentioned you asked about the dietary.
Yeah.
But nothing else. So did you ask about any social changes, like if he goes outside or something like that?
No, I didn't ask about that.
Okay. So the main aim for them was to for us was to educate the mother about the community settings and how to resolve from that, probably in a parental separation. Is it not?
Yeah, something like that. Just to
This
tell
is
the mom
actually
how to.
educational scenario, yeah.
Yeah.
You should not take history, actually. You should just comment on the mother's concern and what treatment you can offer. That's it, actually.
Okay, thank you.
So next scenario, yeah, thank you very much. Next scenario, Dr. Nivetha.
Next scenario, ma'am. Speak to a teenager who came with a fainting episode, ma'am.
Okay.
Outside it was given that blood showed iron deficiency anemia. Explain management and treatment. This was also like information giving, ma'am.
So information giving, as I said in my meetings, information giving are the most important scenario.
Yeah.
Teenager with fainting attack, and why the fainting attack happened? Diabetes or what?
No, ma'am. Iron deficiency anemia, IDA.
Iron deficiency anemia. So she was not ready. She came with the fainting attack, and you have to give advice that this is the cause. So
Yes,
if
ma'am.
you don't treat your iron
That
deficiency.
is, it was given that outside bloods done showed I was appropriate for iron deficiency anemia. They didn't give the reports and all, ma'am.
Oh,
It was just given bloods done showed iron deficiency anemia. Please
oh,
explain about that to the teenager.
okay. You do diagnosis and explain the
Yes,
management
ma'am.
portion.
Yeah.
Yeah. So how did you?
Yes, ma'am. This was like initially I asked if she's been informed. She informed her parents. She said yes, she's informed and they're coming. And I said that the bloods were done and this shows iron deficiency anemia. So she wanted to know why the causes, like why did I get it? So I explained the causes of IDA. Then she's like, next what I should do. Then I said we'll be referring to dietitian and they'll be giving her medicines, iron supplements. Then she was concerned if the iron supplements had side effects. So I said about the stools, black in color and all that, ma'am.
One thing I'm very much sure that in communication scenario, you will get one communication you will get about medication, and
Yes,
the drug side effect of the medication is very, very important. I have given some notes to that side effect of the drugs. Please go through that notes, everyone. That notes are very important. So side effect of the drug. In my exam also, I got one side effect of the medication, and Dr. Nivetha also, Dr. Renuka also got. Yeah. Okay, Dr. Nivetha, next, proceed.
And then after that, she was like, she was not good in taking tablets. So she was like, if there was any injections which I can get for increasing this thing. Then I said there are thing, but that I have to discuss with consultant because because I said that first she has to take her oral thing, and then if she's not comfortable, and then we can discuss with that.
Very good.
About that.
Very good. Yes, very good. You can't say no. And
yes,
you
ma'am.
say yes. Here you have to ask consultant because that is a decision of consultant actually. Yes, very
Yes,
good.
ma'am. So that's all, ma'am.
Anyone has any question? Some chats I can see, but open your mic and you can ask. Anyone has any question? Okay. Anything difficult question, Dr. Nivetha, or it was just?
No, ma'am. This was like this teenager was very cooperative, ma'am. Yeah, it was just like information.
What was the cause actually? Did you explore what was the cause?
Yes, ma'am. So when I said that this and all could be the cause, she said yes, I had a heavy menstrual bleed.
So cause.
She said that one.
Okay, cause you said, right? What is the cause of this IDA? What can be the cause?
Yeah, I said it could be because of blood loss, like a period. When you have a period, there can be a heavy blood loss. So that time she said, yes, I have heavy periods. Yeah, like
So
that.
that is the knowledge part. Yeah, that is the knowledge part of iron deficiency anemia in a teenager child. If it is a small child, you have to rule out worm infestation. If it is a small child, you have to rule out von Willebrand, hemophilia, these things of disease also you have to rule out.
Yes.
Okay, very good. Next station, shall we proceed? Next station. What is the next station? History taking.
History taking.
What was
so this history taking, I had to take history from the father. This was a 12-year-old child, a known case of cerebral palsy and spastic diplegia, ma'am. This was the comment which was given outside.
Okay.
And had some concerns about movement.
Okay. Abnormal movement, right? Abnormal
movements. Yes, ma'am.
So what was the movement actually?
Ma'am, actually here when I started taking the history, already the child is a known case of cerebral palsy, ma'am. The child had like this prenatal, natal and postnatal history and all was like too big, ma'am, because the child, and one more thing over here, the father and mother were not together. The father was the one who's raising the child.
Oh, so this is single father.
This is a single farm. Yes, ma'am. So there were like more social concerns. And here, yeah, here, no, ma'am, this child had a dislocation, ma'am.
Yeah, possible. Dislocation is common in CP child.
Yeah. And this father said they've done some surgery, but I'm not sure about what surgery it was.
This was a corrective surgery about.
Yes, ma'am.
This is actually in what is the complication, orthopedic complication of CP child? Number one is stiffness, muscle spasticity. It can cause contracture of the joint.
Yes,
Number two is dislocation of the joint. erosion, arthritis, these are all complication.
Yes, ma'am.
So avascular necrosis is also very common in CP child. So
Yes, ma'am.
any surgery that is limb correction surgery, maybe this done. Yeah. So what was the abnormal movement?
Ma'am, I just commented over here could be some hip dislocation.
No,
I just
abnormal movement means gait abnormal or involuntary movement. What is that? I don't understand.
Not involuntary movements, ma'am.
So gait, abnormal
Yeah,
gait.
gait. Yes, ma'am.
Okay, abnormal gait. So gait and movement is totally different thing, na?
Yes, ma'am.
Means it is chorea, athetosis, hemibellisma,
Yeah,
stick.
correct.
And gait means, limping, Trendelenburg. Yeah. So that
But over
was
here,
gait. Okay.
but over here, I had to focus more about the social history, about being a single parent, how he takes care of the child.
Yes, social history. We always tell in the class that that in the history taking and in the communication in UK, especially in UK, treating of one child is two aspect. One is medicine and surgical aspect, that is a medical field. Another is non-medical field, that is social field. When you treat any patient in UK, if you are a doctor in UK, you will understand we only do not treat the people medically or surgically, we treat socially. Okay, it is called a holistic approach of treating a children. Even we give treatment to the parents. We refer the parents, that parent needs support. Okay, so UK is a very good in medical field because we do not give only treatment for the children, we give treatment for the full family. That is the beauty of UK actually. Okay, so father, so what was the discussion going on? What was the DD you gave?
Ma'am, my DD was like some worsening stiffness. So this is like the DD I gave, worsening stiffness, dislocation.
I mean DD of abnormal gait, right? Because
yes, ma'am. DD. Yes, ma'am. Yeah.
DD of abnormal gait. So you gave orthopedic. You gave all orthopedic DD,
yes,
right?
ma'am. I gave orthopedic. And then my question was like, what is the approach for this child? So since it went like a chronic CP child approach, ma'am.
Okay.
Teams involved. And since there was more of social problems because it's a single father, more of that. And this child had some problems in school also. So I was like, have to speak to the school.
Bullying or what?
Yes, ma'am. Bullying. Yes, ma'am.
Very good. So you explored the school. That is very important. Teenager. Yeah. So you asked HEDAS history. Am I right?
HEDAS. Yes, ma'am. Yeah.
You asked about sleep. Yeah. Alcohol. Anything. Misuse at family.
Yes,
social issue.
Yes.
And abuse by the parents. You
yes,
must. Non-accidental injury. Remember,
yeah.
non-accidental injury in this child, 12-year-old, is very common.
You
know why? Because he has neurodisability. Normally, a 12-year-old child, parent will not do abuse normally, but this is a neurodisabled child, so very common abuse. Yeah. So that you must be ruled out, right? Abuse by the father.
Yeah.
Okay, very good. Any other thing?
I have a question.
Yeah.
Do we have to mention about neglect because he's a single father? He may be having some problems.
Yes.
The physiotherapy may not be up to date and may not be going on. It should be, and that is causing worsening of the strictures and abnormal weight. Thank you.
Yeah, Dr. Nivetha.
Yes,
what do you think? Neglect should be mentioned.
Yes, ma'am. I of course said because this is a single father, there's nobody else taking care of. I would like to rule out other NEI aspects also. So I'd like to involve the social worker also. So this is how I said.
Very good.
Yeah.
Next. Any other question? Anyone? Any question, Dr. Nivetha? Did you miss any point?
This was like a very vast history, ma'am. It was not like through a single DD. It was like we have to discuss about CP. We had to discuss about the social concerns, like that, ma'am. It was like it was not focused on one thing.
Yes, MRCPCH is history like that. There will be 8, 9, 10 concern of the parent. And you have to rule out everything. You have to do every single discussion with the examiner.
Yeah,
That's why
it
it
was.
is 9 minutes. That's why it is 9-minute discussion.
Yes,
Any
ma'am.
question? Did you stuck? You did not answer anything like that?
No, ma'am. It was just like, who are the teams you like to involve? How would you like to approach? It was the normal questions, and I kept speaking, ma'am.
Wait, in your history taking, I can see some comment. Okay, I'm reading the comment.
Yes, ma'am.
There is issue with confidentiality, something. Minor issue with confidence. No, you were not so much confident. Okay.
Okay.
There is shuttle cube length of mobility problem. Okay, like time of surgery 1 year back. So you did not ask about the surgery time. When was the surgery? So surgery time will indicate you the cause of the surgery.
Okay, ma'am.
You did not do that. In the management portion, there were several plan need to made. So you did not complete your management. Okay. Several point you missed, and although they gave you good marks, so even if you missed, there's chance of high mark. So don't worry.
Yes, ma'am.
And they said you did not gather information so much correctly. You did not interpret the plans. Okay, interpret the information. I mean, there was some mismanagement in your plan of treatment. They said maybe. And in history taking also, there were lots of issue in this child. Yeah.
Yes, ma'am.
Okay, so this was the history taking CP child with diplegia, and there was abnormality in the gait, problem in the movement, so single father. So there were lots of issue, and dislocation was there, surgery was done. So there were lots of issue actually. Next, development. Yes.
One question. Sorry,
Yeah.
one question.
Yeah.
As he is a single father, do we have to ask about any girlfriend or anyone, any factors that the father may not be taking care of the baby?
I didn't ask about girlfriend.
But you could ask. You could ask. There is no harm. You could ask. Is there any relationship? Do you have currently any partner at your home? Or someone coming at you? Because it can be abused by the new partner. Yes, you are right.
Yeah.
You can ask, no problem. In history taking, you are allowed to ask question. Okay. Any more question? Okay, next development. What was the case?
It was the comment was 2.5-year-old child with speech and language delay. And I was asked to assess the social area also, ma'am.
So how much area you should ask?
Speech, language, and social.
Oh my God. So did you complete?
Yes, ma'am, I could complete it. This was an autistic child, ma'am.
Speech, social, both, right?
Speech, language, and social. Yes, ma'am.
Speech, language, and social. So it was the autism spectrum disorder.
Yeah, autism spectrum. Gross motor and fine motor was okay, ma'am. Actually, this child did not have any other major concerns. The mother was fine. I think there was another younger sibling. That younger sibling was normal.
Okay.
And this child had a seizure, but was not on any medications because it was not a febrile seizure also. This was an afebrile seizure, but just lasted like 3 minutes. And when they took the child to the ambulance itself, the child was fine. They did not give any medicines.
Okay. So it was not recurrent. It was just one time single episode. Yeah.
Yes, ma'am. And when I was assessing, I think the developmental age was around 1 year, ma'am. I'm not sure about that, but yes.
So behind.
Behind, yeah.
Because it is autistic child, he will be definitely behind.
Yes.
But autistic child main problem is speech and social. So this child is global delay because two areas involved, speech and social, two area.
It went like usual questions about autistic spectrum disorder.
What question they asked you?
Like, what is your approach? Same, I like to take history, I like to examine the child. And about management, who and all, mainly they asked me who and all are the teams you like to involve over here.
Okay. You definitely mentioned developmental pediatrics,
yes,
right?
ma'am. Developmental pediatrician.
Okay, any other?
And I think they asked me like, how will you diagnose this child? I said we'll be giving a questionnaire to the mother.
EDOS questionnaire, right? You remember that?
Yeah.
Yep, very
Yes,
good.
ma'am.
EDOS questionnaire, actually EDOS assessment we do for autism.
Yes.
Okay. So there is no diagnosis, there is no testing actually. Unless
Yes,
the
ma'am.
child is syndromic, we do not do genetic testing.
Yes, ma'am.
For syndromic child, we do genetic testing.
Yes, ma'am.
Okay.
That's all, ma'am.
Anyone has any question to Dr. Nivetha? We finished our session today. Anyone has any question? Anything about our clinical exam? Any question, please open your mic and you can ask, or to Dr. Nivetha. So Dr. Nivetha, for few sentences, you just advise them what is your advice to pass exam or?
Anything can come in exam. So, but you have to follow the format.
Yes, very good advice.
Yes, ma'am.
Okay, anyone has any more question? We finished our session today.
Ma'am, I have one question. Sorry for disturbing.
Yes. Yeah, no, we finished our session. You can ask any question. Yes.
Yeah.
Ma'am, like we are going to appear in Pakistan station this year in my attempt. So if we are taking exams, so what will be our communication language in the Pakistan? Like here we have to face the Pakistani patients. So we will be communicating in the local language, Pakistani language, or in English.
Actually, you can talk with the patient in Hindi, but to the examiner, you cannot talk in Hindi or Pakistani language. Okay. But like lie down here, open your shirt, give me your hand, look at my eye, like that. This command you can give, but you have to translate the examiner. You have to tell the examiner, sir, shall I speak in my local language to the child so that the child can understand me? You got my point? So you have to take permission from the examiner.
Okay, thank you.
Because sometimes examiners are British. They will not understand Pakistani language, right?
Okay, thank you.
Yeah, most welcome.
Hello, madam.
Yes.
Yeah.
Yeah. What are the books like, madam, to start off with reading, like this discussion part, madam?
Yeah, for discussion part, I studied and I advise Mark Beatty's very good book. There is a Malaysian Secret in Pediatrics. That is also a very good book. There is one book called Wayne Harris, an Australian book, but that is, I found long case, like, JIA, SLE, they are very good in Wayne Harris, short stature, tall stature. If you want to get knowledge, you can read Wayne Harris as well.
Which one, madam?
Wayne Harris.
Harris, yeah.
Yeah, Wayne Harris.
You have that in that, do you have that book, madam?
Telegram,
In your
yeah. Telegram.
Yeah.
Yes, I have.
Yeah, okay. Yeah. Thank you.
Yeah, most welcome.
Hi, Dr. Nivetha.
Yeah, hi.
Yeah, actually, a few of my friends are in UK, and I'm also planning to move to UK next month. Maybe I will be appearing after 4-5 months for the clinicals.
Okay.
And few of them advised me that the passing percentage per se in UK is not that very good for overseas candidates, because they don't prefer taking candidates from overseas, and I should come back to India for the clinical. Is it something like that? Like you have appeared in UK only?
Not really. Like if you're living in the UK and you apply for UK exams, because there's no visa problem, you get your slot.
Yeah, the passing percentage, do they
no,
give
see, you go to the exam and they don't even know who you are, where you're working. They don't know anything about you. It's just the way you perform there. You follow the format and they give you the marks.
Okay, fine. There is no preferential selection, no?
No.
Right, great. Thank you.
Yeah, thank you.
Dr. Nivetha,
yeah.
Congratulations.
Thank you.
Can I ask you one question? After passing DCH, Is it okay to take like intense preparation for 4 to 5 months?
Yes, of course. You need preparation like 4 to 5 months. You need to practice more and more. The more you practice, the more you give mocks, the more it helps you.
Thank you.
Yeah. They're asking me if I read topic to topic or I read the previous recalls. Yes, I gave importance to previous recalls also. But as I said, anything can come in exam, but give importance to previous recalls also. Like common topics are common. Like if you're in UK, neurofibromatosis, tuberous sclerosis, all these are very common.
Okay. Dr. Nivetha, you said you were practicing earlier and you were not doing any job for last 1 year. So
Yeah.
you were practicing in India.
Yes, India. Yeah.
Okay, but in India, like we are private practitioners. I'm also into practice for last 8-10 years. The
Okay.
kind of patients which we see here are very much different and the approach is entirely different.
Yeah.
So you just read the books for that, because even if I try going through that approach to my patients, like we have a lot of patients in our OPDs. We usually cater to a OPD of 80 to 100.
Yeah. Yeah.
And 5-6 hours, it's not possible going into that much detail for all the examinations, asking the parents about each and everything, taking permissions to check the baby. So this kind of approach is entirely different, which we follow in UK.
Yeah. So yeah, you're right. But this is what I did in my 2 months of preparation period. I started preparing in that way.
And the
That is
books help you with that?
No, this is not the books. Like I used to do mocks. I used to practice with my friend. I had one of my friend also who was doing MRCPCH. So I used to practice. Like ma'am used to give questions. So this is the way. So the way you practice, you go wash your hands. So it's just like what you read. Go wash your hands. You introduce yourself to the parents. Ask permission for examination. So all that was the 2 months which I practiced again and again.
Okay, like we have to make a routine of that.
Yeah.
Like follow
But
step by step.
yeah, you can't do it in your OP as you said, but before the exam you need to practice it. It will be helpful if you practice with someone like a friend or someone like that.
Okay, great. I think ma'am will be there to guide us throughout our journey.
Yes, definitely.
Dr.
Thank you.
Nivetha actually did a very serious mock candidate. She was very serious about her study and mock. So someone is asking me to join my group. This is my WhatsApp number. So if you message me, I will share you the link of my groups, but I am not very much active in my group because I don't have that much time actually. Free time I don't have because all my students take up my times actually. They are very dedicated, and so that's why I am very silent in other groups, because I try to maximum concentrate on mocks. That is my students are giving with me. I have to actually raise them. So it is my duty for them. So I'm not active in any other Facebook or WhatsApp or Telegram. You will not see any activity. Sometimes I post just groups, just meetings and books, nothing else. So other groups, other peoples have lots of time, so they can discuss, but I don't have that much time actually. I'm really sorry for that. So this is my number. I can add you to my WhatsApp group or Facebook group. You can get help definitely. And so all the best for you. And in between, after Ramadan, inshallah, we will do again how to take preparation, common station, like communication, history taking, how to do that thing. We will inshallah start again. And Dr. Nivetha, thank you very much for your time. You passed, then even you voluntarily you tell me, madam, please, I want to give feedback. That is very kind of you, because people pass and they forget. This is the common nature of human. Then when you are benefited, you just forget everyone. But you did not forget me. That's very kind of you. Thank you very much.
Thank you, ma'am. Thank you.
Thank you so much, Dr. Nivetha.
Thank you.
So everyone, I hope Dr. Nivetha's feedback was very helpful for you. And this is my WhatsApp number if you want to contact for any reason, any purpose. And soon we will start another meeting with after Ramadan, definitely with communication history development. And look on my channels so that you can get early notification of the meetings. Okay. Thank you very much, everyone, for joining.
Thank you.
Thank you, ma'am. Thank you, Dr. Nivetha. Thank you.
Thank you so much.
Bye bye.
Thank you. Thank you.
Assalamu alaikum.